sir.
Okay, fine.
Sir, I'm audible, sir.
Okay, audible is it?
Namaste, good evening, everyone. Myself, Aushadhi, studying second professional BMS at Ayurvedic College, Bangalore. And I would like to introduce my team, Panchajanya, the divine coach of Bhagavan Sri Krishna, which was blown during Kurukshetra, indicating the start of the Dharma Yuddha that followed. There all the efforts were done for the establishment of Dharma. Dharma was kept over personal relations and motives. Keeping the same motive in our mind, organization will work towards establishing the importance and necessity of following and imbibing Bharatiya culture, accepting our roots and making people realize the true essence of Ayurveda, not only as the treatment modality but also as a way of life. All these while walking in the path of Dharma. Hence the motto Shreyam Bharatiyam Arogyam Ayurvediyam. With this aim in mind, I would like to welcome you all to the Pragnavaridhi lecture series conducted for the second year BMS students. Today we have Dr. Vd.Iranna Sajjan sir, BMS MD in the subject of Rsbk. Now sir will deal with the topic Aushadhi Kalpana 1 and single drug formulations. And here is sir working currently as an associate professor in Department of Rsbk SIMC Hubli with true knowledge of classical herbo mineral formulations prepared for dispensing at SAMC hospital with their quality control and published articles. Sir worked as a chairman person at many UG presentations. They are presently working as a guide on short-term research grant for UG students approved by RGUHS University Bangalore on topic pharmaceutical, analytical and in vitro antimicrobial study on Pranapahari Rasa. Recently, Sir has done a presentation on topic stability study of Gruta with special reference to Shatavari Gruta at 10th World Ayurveda Congress held at Dehradun. Sir, we wholeheartedly welcome you, sir. Sir, now I'm handing over session to you. You can please continue.
So, good evening to all the team Panchajanya. So, I feel immense pleasure as I have been invited by you people for presentation of today's session for second year BMS UG students. Today, I am going to deal with two topics, that is, which is from second paper, that is Ayurveda Aushadha Prayoga, as well as first one, that is single drug herbal and mineral formulations. Okay, so I would like to mention the drugs which are being mentioned in your syllabus. So that is first is the drugs which are of herbal, that is Guduchi, Amalaki, Ballataka, whereas in your syllabus they have mentioned Gairika as well as Gandhaka itself. So moving directly to the syllabus as well as the marks allotted in your syllabus. Firstly, the whole of this point holds about 10 marks in the syllabus. So, first, likely the long answer question would be from this, that is for 10 marks. That will be optional, that is for the first question itself. Okay. So, moving to the short answer question, it may come about 5 marks question, that is 2 questions, that is mandatory. Moving to the multiple choice questions, it will be of 2 or 3. Okay. So moving to the next one. So these are considered to be an must to know formulations that are being explained in your syllabus. So that is describe the different dosage forms prepared out of the single herbo or mineral formulations, that is must to know. Appreciate how the therapeutic efficacy varies depend on the dosage form, that is also a must to know in your syllabus. Moving to the 3 of the formulations, that is Guduchi, Gairika as well as Gandhaka. So we are supposed to describe the therapeutic efficacy of different dosage forms of these three drugs. So one of they have mentioned all also, and one of the Vishadravya, that is Ballataka, and you are supposed to mention the toxic effect as well as remedies. That comes under nice to know, but most probably in recent questions, that is about 10 years of your question papers, they have mentioned the this question, that is regarding the Ballataka, many times. So it may be a probable question also. So moving to the topics that to be discussed, so you are supposed to know clearly the formulations, which are such as Guduchi. Under Guduchi, you are supposed to know about the formulation, that is Guduchi Swarasa, the preparation formulation that to be prepared, as well as Guduchi Adi Chuna, Guduchi Kwata, Guduchi Hima, Guduchi Gana, that is also known as Samshamani Vati. Okay, Guduchi Sattva and Amrutadi Gugulu, Amrutarishta. Okay, these are the drugs that are formulated in your syllabus in the heading of Guduchi, whereas in Amalaki, Amalaki Swarasa, Amalaki Adichuna, Trifala Rasayana, Chavana Prasha. So regarding Chavana Prasha, they have mentioned 2 to 3 times in your syllabus. Chavana Prasha is considered to be a most likely question for the 10 marks. Okay, then it is also been repeated in the nutraceuticals also. So most of the likely or a choosy question, it may be Chavana Prasha. Okay, so then Dhatri Loha, Amlakyadi Gutika, Falatrikadi Kwata, Trifala Gruta. So in Trifala Rasayana, they have mentioned about the preparation that is quoted in Charaka Chikitsa Sthana. Okay, so Rasayana Adhyaya, all the four of these Trifala Rasayana should be known to you people. Moving to the Ballataka, as the drug itself is an Vishadravya, comes under Upavisha Varga. It should be known how it should be purified, and all other things should be known to you. So under this name, they have mentioned about Ballataka Modaka, Ballataka Gruta, Ballataka Guda, Ballataka Adya Taila, as well as Ballataka Avaleha, Ballataka Adi Lepa, Ballataka Adi Kwata, and moving to the Gandhaka, that is first drug of Uparasa Varga. So they have mentioned about Gandhaka Churna, Gandhaka Rasayana, Gandhaka Dhriti, Gandhaka Taila, Gandhakadya Malhara, as well as Gandhakadi Lepa, Gandhaka Vati. Moving to the Gairika. Gairika, so if it is asked for Gairika, you are supposed to mention the simplest method of purification, that is the Savarna Gairika can be done Shodhana by a simple method of Bharjana with Gruta. So you can mention this during all of the questions, it may appear. Okay, Gairika Pradeha, Lagu Suta Shekara, Gairikadya Malhara, Gairikadya Gutikanjana, Gairika Rasakriya, Varanakara Lepa. Okay, these are the formulations that have been mentioned. Moving to the formulation proper. So I have mentioned one of the method, or the how to write the formulations with an example. I have considered one of the simplest formulation, that is Guduchiadi Churna here. So please note down the method that should be adopted during the writing of these questions. So in the prayer, you are supposed to write about the ingredients first. So method of preparation, MOP. So if it is asked for 10 marks, you are supposed to write the method that are being adopted in your practicals also. So you are supposed to write the instruments that are required for the preparation and dosage forms and anupana, the indications. So in all the which all the diseases it can be given. So you are supposed to write about the pharmacodynamics. So it is well and good to mention many of the words that are related in the Ayurvedic system. So, for example, I have mentioned about antipyretic, jwaraguna, digestive, it may be deepana pachana. Such words are favorable for the valuators. So, please note such codes in your exams. So, pharmacokinetics, what are the things which are being manipulated in the body itself? So you are supposed to mention the route of administration in all of these formulations. Okay, whether it is an formulation that can be internally used by oral intake, okay, or if it is an LEPA, you are supposed to write about the external application as well as the system, how it works. That is, you are supposed to write about the trans drug delivery system also. In if it is taken orally, you are supposed to write about the distribution, how it is distributed in the body, as well as how it is metabolized and excreted. So moving to the first one, that is Guduchadi Chuna, one of the formulation, you are supposed to write the ingredients that should be taken in raw form. After you are taking the raw drugs, you are supposed to write about how it is used. That is, if it is used in an, if for example, I have mentioned the kashaya chuna here. If it is kashaya, you are supposed to write about the process of pounding in kalva yantra, clean kalva yantra, and it is made into an yavakuta form, and it is further used for the preparation of the kashayas. Or if it is for chuna, you are supposed to go for fine powder or sukshma chuna or atyanta sukshma chuna. And all the above ingredients should be used in equal part. Okay. For example, in this formulation, guduchi, ativisha, shunti, chiraita, kalamega, nagarmota, pippali, yavakshara, kasisa, champaka, these all the drugs should be taken in equal quantity, and they are supposed to be pounded in clean kalvayantra separately, and all the ingredients should be filtered through a cloth, clean cloth. After that, the powders which are gained from this process should be mixed homogeneously, and homogeneous mixture can be used in the dosage form of 3 grams. Okay, the normal dosage of any of the tunas can be considered between 1 shana to 1 karsamatra. So you are supposed to mention the Ayurvedic or Mana Paribhasha terminologies. So Anupana, whether the drug is taken with any of the adjuvants, that should be mentioned in all of the formulations. So moving to the indications, this drug is indicated in Yakrut Vikaras as well as Sarva Prakara Jvara, as the drugs which are being mentioned are scientifically proven that they are having the pharmacodynamic actions such as antipyretic, that is Jvaragna. So you are supposed to classify the drugs which are in the formulations, whether they are antipyretic, anti-inflammatory, that is Shotahara, if they are having the digestive as well as carminative, they are supposed to be mentioned as Deepaniya, Pachaniya, Rechaka, Mrudu Rechaka. Such terminologies should be mentioned. Hepatoprotective action is done by Musta as well as Yavakshara, and it is you are supposed to mention about the pharmacokinetic action. So it is used or ingested internally through oral cavity. So the absorption is done in the gut itself. So the after the lysis of all these drugs, they are metabolized and absorbed in the mucosa layer of GI tract. Then all of the drugs which are being metabolized, they are being entering into the liver itself for metabolism, and after the metabolism it gets excreted by the two system, that is urinary system as well as it is exceeded by feces. Okay, so many of the questions that can be asked in this category are, note down some of the questions for multiple choice. Ingredients of Guduchadi Churna, recommended dose of Guduchadi Churna, primary indication of Guduchadi Churna. Here you can write Yakrutli Havikaras. Okay. The ingredients that can be mentioned in this for this question also, how the Guduchadi Churna is administered. So it may be a confusing question. Is it an internally administered or it is used an external formulation? So these may be the question relating with the Guduchadi Churna here. So moving to the short answers that can be related with these formulations of these formulations, single drug, herbo and mineral formulations. So Amrutadi Gugulu. So this is the reference. So the syllabus is so particular that the reference which are from other text may not be holds good here. So you are supposed to be thorough with the references or the references quoted in your syllabus. That should be known to you. No any other formulation from other text, classical texts are not so holds good here. So you are supposed to read and get thorough with the formulations that are being mentioned in your syllabus. So for a short answer for 5 marks, they may be questioning about preparation method of Amrita the Guggudu. So you are supposed to write, if it is asked for 5 marks, you are supposed to write the ingredients in it, the method of preparation, so how the Guggudu formation is done, so what are the processes that should be used, pharmaceutical processes that should be done during the preparation, Trifala Gruta. So these are the formulations that can also be repeated in your final year also. Trifala Gruta, it can be explained in your Shalakya Tantra also for Akshigata Rogas. So be thorough with these formulations which will be repeated in your final year also, as well as they are very helpful in your future practice also. So be thorough with all these formulations. Ballataka Guda. So in this you are supposed to explain about the Ballataka drug, how it is done or prepared for shodhana, then how it is preserved. Or so for example, the ballataka seeds are taken, they are being cut at their small pieces, they are being mixed with istika chuna and tied in an pottali. So after the oil is being taken out, that is when they get shodhita, they are being subjected for washing in warm water, and they can be utilized for the preparations, pharmaceutical preparations. These are the some of the questions that can be appear in your exams. So I have mentioned some of the questions which are being taken from your senior batch, that is 10-year question papers have been listed out. So these are the formulations that have appeared in your senior question papers. Lagu Sood Shekara, so you are supposed to write the formulation, that is the previously I have mentioned about gairika shodhana. You are supposed to write the matra of gairika, as well as what are the ingredients that are being used during the preparation, then swarasa that is used. So in our pharmacy we are preparing lagu sood shekara by the gairika are being taken in two parts, and shunti churna, fine shunti churna is being added for one part, and they are processed with nagavali patra swarasa, that is taken, and it is processed by mardana, and after proper mardana they are being rolled into tablets and used for the therapeutic purpose. Okay, ballataka shodhana as well as avidhi shodhana. So in the agada tantra they have mentioned about the ballataka as well as the method of shodhana, and what are the harmful effect if they are being consumed in excess matra, or how it is to be used, and what are the uh, methods that can be adopted for the shantopaya, that is what are the remedies. So gruta as well as shita jala, such other methods are being mentioned in your agada syllabus also, so they are to be mentioned here. Okay, moving to the long answer questions that can be appeared in this part, that is for 10 marks. So it is an optional question, so most probably they can ask the formulation such as Chamanaprasha. So I have mentioned the Chamanaprasha. It is been repeated 2 to 3 times in your syllabus. You are supposed to be thorough with the ingredients, that are 48 ingredients. So what are the ingredients that to be with the matra? How the amalakis are being processed? So the processing of amalaki, so a kashai is prepared, so you are supposed to elaborate the method of preparing chavanaprasha here. Okay, so should I mention the preparation method of chavanaprasha here? Okay, so all the ingredients that should be used. So first prior 36 ingredients, 32 to 1 to 32 to ingredients are should be used in an Yavakuta farm, that should be uh, prepared with the kashaya of 12.4 liter of 12 liters. Okay, it should be processed, and 500 matured amalakis are taken, and they are should be tied in an pottali. The potali should be suspended in the kasha itself during the process of So this is an one of the techniques. So the kasha is also at a time prepared, as well as the boiling of the amalakis also are also done here. So after that, it should be reduced. So one fourth part, and the kashaya should be filtered. At the same time, the amalakis are taken out, and seeds as well as fibers should be taken out by the process of mass. The pulp is taken out and it is filtered through cloth. The pulp that is obtained should be fried with grita. So they have, in the classics they have mentioned 288 grams of grita should be taken, and it should be fried till it gets a golden brown color. After that, so Khanda Sharkara is also been mentioned, that is of about 4 kgs, 4.8, I think so. That should be, it may be powdered or it may be powdered. That should be added to the kashaya, and a paka lakshana should be observed. To that, the fried pulp of the amalaki should be added. Then it should be mixed thoroughly to become an homogeneous mixture. After the preparation of homogeneous mixture, the other ingredients such as prakshepaka dravyas that should be used and mixed thoroughly with the drug. After swangashita, madhu is added. So after swangashita, the madhu is added and the homogeneous mixture is prepared, and it should be kept in an airtight container for the further therapeutic use. So in this formulation, you are supposed to elaborate about the, as it is been mentioned in Amalaki yogas, you are supposed to write about the use of amalaki here, as well as the many of the ingredients that such as jivani gana dravya as well as dashamula are being mentioned. So pharmacodynamics as well as pharmacokinetics related to these drugs can be mentioned here. So anti-inflammatory as well as uh, rasayana properties that can be mentioned here. It is been internally used. The matra that can be given, that is in pediatrics, you can go for 6 grams to, in the adult, you can go for half to 1 phala matra. It should be mentioned. And the anupanas, you can go for kshira or jala. Such, you are supposed to mention all these things. Then the therapeutic purpose of this ingredient as well as the uses, that is it can be used for pranavaha srota vikaras, shwasa kasa as well as kshaya. It can be given in such disorders. So should I elaborate the uses? Am I audible?
Yes, sir, you are audible.
Should I elaborate the therapeutic utilities in different srotas?
If you have time, you can brief it, sir, enough.
Okay, fine. Okay, fine. Okay. So still one more point is there for your syllabus, from your syllabus. Gairikadya Malahara, you are supposed to mention the method, that is Malahara preparation. So how the Sikta Taila is prepared, what are the other ingredients? So in the first, you are supposed to mention about the ratios, that is Giri Sindura, how it is added, and all other ingredients, what are the quantities or the matras that should be added. And how it is used therapeutically. So it is an one of the malahara that is used externally. So you are supposed to write about the how it will be acting. Okay. So many of the researches are being done. So if you have the knowledge regarding the researches, you are supposed to write or mention about the researches also. So for example, I am giving about the Amrutarishta. So Amrutarishta, the formulation includes Amruta as well as Dashamula and the quantity of jala that should be added, and what till how it is reduced. The preparation of kashaya should be mentioned. According to this, I will be. These are the main points that should be mentioned here. So, relating with the patya, so in general, you can go for the patyas that are being mentioned in Swastha Rutta. So, Mudga, Shashtikashali, Goduma, Gokshira, such you can write. So that the one of the point that is been mentioned in your syllabus can be mentioned there also. So, what should be the duration of the intake of these medicines? So, if they are so as they are having some of the mineral origin as well as herbal drugs. So, herbal drugs, as usual, it can be given for a duration of 60 days, whereas if they are having any of the paradadi dravyas, it can be given for 45 days, and a gap of period of 1 month, 15 days to 1 month can be considered there. So the any of the remnants in the body that can be flushed out in this duration. After that, the formulation can once again be repeated for the patient. Okay, that should be the Sevana Kala or Sevana Avadi Kala Maryada. That is Kala Maryada. So, should I explain one more formulation for this? So, Ballataka Shodhana as
It's
well
okay.
as Avidi. Okay. So, moving to the next point, that is Aushadhi Kalpa. First, that is compound formulations. So, in this point, they have mentioned about the uh, rasayanas that are being prepared by different methods, that is Karaliya Rasayana, Parpati Rasayana, Kupipakva Rasayana, Potali Rasayana. So, you are supposed to elaborate the preparation method, that is utility of Kalva Yantra, whereas Parpati preparation method and Kupi Pakwa method, whereas Potali method also. Okay. So it is for moving to the distribution in the syllabus. So for this point, they have mentioned 15 marks in the syllabus of your syllabus mentioned by NCSM, that too in paper 2. So it is a mandatory question for you people, that is 10 marks long essay, long answer question. That is, it may be for third question itself, that is a mandatory. So these formulations are well versed, very important and daily used formulations that are being mentioned in the syllabus by NCSM by making a proper survey regarding the formulations which are being mentioned in your syllabus. So they are daily used in clinical practice medicines. So be thorough with the formulation, as well as you can also prepare these formulations by yourself also. So short answer questions, that is 5 marks question, one of the question that is that can appear at the fourth place in your short answer question, that is also a mandatory question. So if they skip the 5 marks question, they may go for more MCQs, that may be of 4 questions or 5 questions it may appear. If they skip, that is short answer question, that is 5 marks question, so it may be of 10 marks, as well as 5 MCQs can also appear in your question paper here. Okay, so in this you are supposed the in your distribution of syllabus, they have mentioned describe the references, ingredients, therapeutic properties, dosage, and all the administrative details along with the anupana of each formulation, that is must to know. Okay, explain patya apatya sevana vidhi, avadhi, duration of treatment, and shelf life. So please note down. I didn't mention regarding the shelf life in your single therapeutics. Okay, so please mention the shelf life period of all the drugs mandatorily. Okay, in throughout your answer booklets. So it may create an one of the wonderful point for the evaluators. Please mention shelf life of the formulations of each of the formulations which will be mentioned in the question paper. Okay, formulation shelf life. Okay, interpreted probable mode of action, that is pharmacodynamics as well as pharmacokinetics of the formulations, research updates, and clinical evidence of such. So, desirable to know, they have mentioned about Arogyavardhini Gutika. So, this is the most likely question in your senior question papers, that is Arogyavardhini. I don't know why they have mentioned in desirable to know in your syllabus. That is most of the favorite question in your senior syllabus, that is CCM syllabus. Critical analysis, compound drug for their therapeutic action mentioned in the classics. Okay, so in this formulations, so clearly I have mentioned in the single drug, that is the you are supposed to go for ingredients, and if it is asked for 10 marks, you are supposed to write about the method that are adopted in the practicals, that is instruments, then what are the dosage, that is ingredients, their quantity, how they are used in kashaya form, swarasa form, or in the form of any of the such preparations. So all these, as well as the preparation method. So what are the methods used, that is in Karaliya you are going to go for Mardana the karmas, Mardana Bhavana, such karmas should be mentioned. Okay, critical analysis okay, is it's done. So moving to the matra, the dosage. So don't go for higher dose in these formulations, as they are having some of the Rasadi Kalpas. So keep don't go for higher formulations or higher dosage matra. Anupana, be restricted with the anupanas if the dravya or the ingredients contain any tikshna dravyas. So don't go for uh, Tikshna Dravyas as an Anupana. Be careful regarding the Anupanas. You may write the Dravyas such as Kshira as Takra, Jala, Grita. Such Anupanas can be mentioned here. Patya Patya. So, in some of the formulations, there are some of the restrictions such as the Tikshna Aharas as well as Mamsa Aharas that should not be consumed. They are should be mentioned in the Patyas. Sevanakala. So, is it Abhakta, Pragbhakta, Adobhakta, Muhurmuhu? Such of the words should be used in the Sevanakala. Kala Maryada, previously I have mentioned about the Rasadi Dravyas that should be mentioned for the period of longer period, that can be given for 45 days. After the 45 days, that should be an gap up period. After that, you can once again administer the same. If the any of the side effects that can be, so in any of the pitta vikaras, if the drug such as gandhakadi dravyas which are having mm, nature of aggravating the pitta as well as rakta. So, such side effects or adverse effects should be mentioned. So, for example, if the drug is having Vatsanaba or it may have Gandhaka, such formulations should be written carefully. So, if there are side effects, they should be withdrawn and there should be given any of the Shantopayas such as uh, Shastikashali, Kshira, Grita, that also should be mentioned. Okay, so Ashuddha, Apakwa, or uh, if the basmas which are not been processed properly by basma parikshas, that also should be mentioned here. So likely the chemicals that are being uh, in the formulations. For example, if the drug is having mm, haridra, you can write about the curcumin, its action, and uh, what are its benefits, that is pharmacodynamically how it is antimicrobial, antioxidant. Such words should be mentioned there. So, better to go for Ayurvedic words, that is Shotahara, Deepana, Pachana, as well as uh, Vranapahari if it is an microbial, Vranapahari as well as antibacterial, such Crimigna, these drugs such as Bidanga, some other formulations contain all these things. That should be mentioned here. Okay. Uh, Therapeutic properties. So many of the formulations which are being taken in the syllabus, which are very well known for their therapeutic action also, that should be mentioned. So their applicability should be mentioned as well as research updates. So in the you can use the internet medium and you can extract the research updates from it. So many of the articles are being published relating these formulations which are being mentioned. Okay, Pravala Panchamrita Rasa, such are the unique drugs. Ananda Bhairava Rasa, these are the unique formulations. Vasanta Kusmakara, anti diabetic action of Vasanta Malati Rasa, and the effectiveness of Vasanta Kusmakara Rasa in PCOD or PCOS. Such things should be extracted. So, Brahatvata Chintamani as an one of the good formulation that can be used. Effect of Bharatvata Chintamani in Pakshagata or Ardita, Ekangavata, Gradrasi, such are the articles that are published. So you can go through all the formulations and you can mention two or three from the each formulation itself. Okay. So, for example, I have mentioned the writing method of these formulations. I have taken one of the Parpati Kalpana here. So, in the preparation of Panchamrita Parpati, uh, you are supposed to write the ingredients, that is Shuddha Gandhaka, 2 pala of Shuddha Gandhaka should be taken, Shuddha Parada, 1 pala should be taken, Loha Basma, that is half pala, and Abraka Basma, 1/4 pala, that is 12 grams, Tamra Basma, 1/8 pala, that is 6 grams. So, as I have mentioned, if it is asked for 10 marks, you are supposed to write all the instruments, and the method of preparation is mandatory for all the answers, that is long answers as well as short answer. As you all know the method of preparing any of the Parpati Kalpana, so you are supposed to go for a stage that is prepared from Gomaya, Kadali Patra, use of Kadali Patra, okay, and the potali that is prepared from Gomaya as well as Kadali Patra. So all these, so in this you are supposed to mention about the preparation method of Kajali prior to the formulation. So as Gandhaka as well as Parada are in this formulations, you are supposed to go for the preparation of Kajali. Kajali should be prepared. Later, the other three ingredients should be added. After preparing the homogeneous mixture of these, as I have mentioned about the method of Parpati preparation, Kadali Patra as well as Gomaya. After preparing a homogeneous mixture, you are supposed to take a Loha Darvi, which is applied with a little quantity of Gruta, that can be mentioned as an Sahayaka Dravya there. Okay, Sahayaka Dravya as Gruta. So in instruments, you are supposed to mention about the balance, weighing machine or balance, Khalvayantra, then gas stove or heating agent, Loha Darvi. Okay, all these should be mentioned there, or the spoons which can be used. Okay, after heating the gruta there, all the ingredients mentioned should be placed in that Loha Darvi, and it is heated over the Mandagni. And after liquefaction of the powder, you are supposed to place over, you are supposed to pour over the Kadali Patra, which is set priorly, and it is pressed over the potali. Okay, these are the methods that should be mentioned in your examination. After that, after the pressing duration of 30 seconds to 1 minute, after cooling, the Parpati should be examined whether it is having a good, is it prepared properly or not, that is Kharapaka, Murdupaka, Madhyamapaka, and all these should be mentioned in your paper. Okay, so after that, the dosage, so how it is, so shelf life of the prepared drug. So as classically they have mentioned, if the formulation is prepared from Parada, it is considered to be infinity. So according to the recent text which are been published by government under the Department of Ayush, you are supposed to mention the duration that are being finalized by the formulator that are from AFI. Okay, so in this you can consider it is for 2 to 5 years there. Okay, Anupana Madhu, Gruta, Busta Jiraka Chuna. Okay, the dosage should be half Rati Pramana, and it is indicated in Grahani, Arsha, Chardi, Jwara, Atisara, Kshaya, Raktapitta, Aruchi. So this can be written as I have said about in the first point itself, antimicrobial activity as well as anti-inflammatory detoxifying property. So you can mention Crimigna, Shotahara as well as Shodaka for Gandhaka. Okay. For similarly for Shuddha Parda also you can go for Crimigna, Shodaka, Tridoshagna, and it is considered to be in Rasayana. Okay. So for Loha Basma, you can go for mentioning it improves the hemoglobin. Rakta Prasadaka, you can mention Regiminator. So Rasayana as well as it is considered to be a Rasayana. So for Abraka Basma, it is anti-aging, that is in a jara can be used, and it can be helpful or supportive in many of the systems, that is Annavaha Sroto, Dusti as well as Varasa Shwasavaha Srotos also it can be used. So in many of the formulations, Abraka is considered to be in one of the best preparation, that is Shatabutti or Sahasraputti. So moving to the Tamra Basma, so same antimicrobial, anti-inflammatory, hepatoprotective properties are known by for mentioned for the Tamra Basma. Pharmacokinetics. So you are supposed to mention ADME. So please note down ADME: administration, distribution, metabolism, and excretion. So you are supposed to write for all the preparations that are being mentioned in this topics. Okay. So coming to the this Panchamrita, so administered orally and absorbed through GAT. Distribution is from bloodstream, that is it gets absorbed in GI tract. Okay, metabolism is done in the liver, so excretion is done through feces as well as urination. So moving to the Patya, Kakamachi, Patola, Pugafala, Ardraka, Kadali. So okay, they are considered to be Patya. Shali, Purana Shali, that is Shastika Shali or Purana Shali. Kadali Pushpa is mentioned here. It can be used. Apatya, Amla Rasa Sevana, as it may aggravate the Pittavastha, and Atyanta Shita Jalasnana, Shita Vayu Sevana, and Anupamamsa Sevana, and excess use of Guda, that should be not done. So Apatya. Okay. So moving to the Aushadha Sevana Kala that I have mentioned in the prior talks, that is 45 days, as it contains many of the mineral components. All the components are mineral here. Saviratavadi, according to AFI, it is
Hello, sir. Sir, you're not audible and slide is paused. Sir will be back in 2 minutes. Please wait. Sir will be back within a minute. Please wait.
Am I audible?
Hello, sir. Yes, sir. Yes, sir. You're
Nothing.
audible.
ಬರ್ತಾ ಇದೆಯಾ?
ಇಲ್ಲ, sir.
ವಿಶಾಲ್ ಬರ್ತಾ ಇದೆಯಲ್ಲ?
Yes, sir. ಬರ್ತಿದೆ, sir.
Okay, fine. So, sorry, I was being disconnected. So, Panchamrita Parpati, I was done with that, or I should repeat now?
Sir, starting ಅಲ್ಲೇ ಕಟ್ ಆಗಿದೆ, sir.
ಹೌದಾ? ಇದು ಆಗ್ಲಿಲ್ವಾ? ಯಾರು ಕೇಳಿಲ್ಲಲ್ಲ. ಓಕೆ.
ಇಲ್ಲ,
ಸೊ
sir. 5 minutes ಆಗಿದೆ.
ಓಕೆ, ಫೈನ್. So, as an example, I have mentioned about the Panchamrita Parpati here. So, you are supposed to write about the ingredients that are being mentioned in the Panchamrita Parpati. So, especially they have mentioned A5 first volume. So, Parpati Yogas. So, that too, it has been taken from Vaishya Ratnavali, Grahani Rogadikara. So these are the one of the mentioned formulations. So you are supposed to write the formulations that are being mentioned in your syllabus. Please don't change the references. So be stick on to the formulations that are being mentioned in your syllabus. Many of the older texts have mentioned some other formulation concerned by written by some other classical authors, but the syllabus is framed in such a way that you are supposed to be stick on to the formulations as well as the methods that are being mentioned in the relative references. Okay, so the ingredients that are present in Panchamrita Parpati are Shuddha Gandhaka 2 Phalamatra 96 grams, Shuddha Parada 1 Phalamatra 48 grams, Loha Basma half Phalamatra, that is 24 grams, Abraka Basma half Phalamatra, that is 12 grams, Tamra Basma 1/8 Phalamatra 6 grams. So if it is asked for 10 marks, you are supposed to write all the necessary instruments that are utilized in the preparation of this Panchamrita Parpati, such as balance, that is weighing machine, Loha Patra, that is Darvi, then gas stove for heating purpose, heating aid. So then spoons, Sahayaka Dravya, you are supposed to write Gruta, Gogruta, and Kadali Patra, as well as Gomaya should be mentioned as an Sahayaka Dravyas for the pharmaceutical preparation. Okay. The method of preparation, as you all know, the Parpati preparation. So they are the formulations which are prepared in the method of papad. Okay, papad like appearance is being uh, prepared during the formulation. So Gomaya platform is prepared, and to that an kadali patra which is being smeared with a kruta which is heated with over the mild fire. It should be placed over the gomaya, and one more kadali patra heated with a smeared with a gruta, prepared with an potali of that gomaya itself. And the process of preparing these should be starting with gandhaka as well as parada. You are supposed to go for the preparation of kajali. After the complete preparation of kajali, so it may take 3 to 4 days. So kajali should be prepared. After preparation of fine kajali, you are supposed to add other ingredients, that is loha basma, abraka basma, tamra basma, and these should be mixed homogeneously and placed over the loha darvi, so which is smeared with gruta, and heating should be done with an mandagni. After liquefaction of the powders, so these should be poured over the platform that is prepared with kadali as well as gomaya, and pressed with an potali which is prepared with gomaya as well as kadali patra. Okay, so the duration of pressing should be uh, 30 seconds to 1 minute. So it will get solidified. So the pressing should be very smooth without any uh, hurry burry. So you are supposed to mention about the Parpatis, that is the Lakshana of Parpatis form, that is whether it is an formed with an Lagupaka, Kharapaka, Murdupaka, or Madhyamapaka. So which of them should be considered for the therapeutic purpose? After that, these should be preserved in an airtight container. Okay, this should be the method of writing such formulations. And moving to the dosage, as you all know, it contains parada dravya. So the dosage should be kept minimum, that is half rati. Okay, half rati. So some mistake is been with this dosage. Half rati. Okay. The anupana should be such as madhu, gruta, brishta, jiraka is mentioned in the formulation. That is grahani by Siddharatnavali reference. So indication, it is indicated in grahani, arshas, chardi, jwara, atisara, kshaya, rakta pitta. Okay. These are the indications. Moving to the pharmacodynamics, so you can write the diseases as well as the pharmacodynamic activity of all these ingredients. For example, I have mentioned about all the ingredients here. All the 5 ingredients, that is gandhaka, shuddha gandhaka, it acts as an krimigna, shotahara, and shodaka, whereas Shuddha Parada is Krimigna, okay, Shodaka, Tridoshagna, and have many other actions as it is an Mulaka Rasayana. Okay, Loha Basma, which helps in Rakta Shodhana as well as Rakta Nirmana. It is considered to be an effective medicine in anemia as well as rejuvenator, rasayanam property, and moving to the abraka, anti-aging, that is uh, anti-inflammatory, hepatoprotective, that is Yakrut, Plihavikaras can also be treated with this. Okay, Abrakabasma as an anti used in an GIT as well as respiratory tract diseases, Shwasa, Kasa, Chaya, such diseases it can be. Okay, Tambra Basma, antimicrobial, anti-inflammatory, hepatoprotective as a property. All of these can be mentioned. So ADME should be mentioned for pharmacokinetics. Okay, pharmacokinetics, you are supposed to remember ADME. Okay, ADME is mandatory for mentioning the pharmacokinetics. So coming to the Parpati here, so administration is done by oral route. So absorption is done in a GI tract. Distribution is done as it gets absorbed in the mucosa of GI tract and distributed in the bloodstream. When it comes to the metabolism, it is metabolized at metabolized in liver, and excretion is done through feces as well as urination. So patya as well as patya should be mentioned in these formulations. So in patya, kakamachi, patola, pugafala, ardraka, kadali pushpa, puranashali, Godugdha as well as Sharkara are considered to be in Patya Dravyas, whereas Apatya, Amla Rasa Sevana, Shita Jala Snana, Shita Vayu Sevana, Anupamamsa Sevana, as well as Guda, Ati Guda Sevana is considered to be Apatya. Nimba Dravyas, Nimba should be avoided, and uh, uh, other viharaja or manasika gunas such as krodha, chinta, all these as well as stri samboga should be avoided in the consumption of this panchamrita parpati. Okay, Aushadha sevana avadhi. So clearly I have mentioned that is 45 days as it contains paradadi dravyas. So Kala Maryada is 45 days. After that, Shamana Kala, that is, it should be given for completely about 1 month, it should be avoided. After that, you can go for the further use of the same drug also, or you can change the prescription. Savirata Avadi, that was been mentioned in EFI, that is 8 to 10 hours. So 10 years. Okay, so in this period these medicine can be used. So later to that they are considered to be having inefficient, whereas in classics they have mentioned it is infinity, but according to AFI they have mentioned only 10 years. Mention the note down some of the questions that are being appeared in your syllabus, that was CCM syllabus question papers. Preparation method of Chandraprabhavati, Prayoga Vidhi, as well as Saviratavadi. This was the question mentioned in your older question papers. Preparation method of Ananda Bhairava Rasa, effectiveness of Vasanta Malati Rasa, Vasanta Kusumakara Rasa. So these are the questions that can be for 5 marks, yeah, asked for 5 marks. So in this, Chanda Prabhavati can be asked for 10 marks question. Chanda Prabhavati, Brihatvata Chintamani. ಹಲೋ 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 ಹಾ ಹೇಳಿ. ಎಂಡ್ ಆಗ್ತಾ ಇದೆಯಾ? ಏ ತೋ ಪೇಷಂಟ್ ಅವ್ರು. So Sevana Vidhi, Patya Apatya. So these are the many of the questions. So for MCQs, they may ask the quantity of Swarna in Swarnavanga and the quantity of Loha Basma in Navayasa Loha. Drugs in the preparation of Samira Pannagarasa can be the multiple choice questions. The matra of Kumar Kalyanaka Rasa for MCQs, these can be asked. So many of the updates can be collected from, that is the research updates can be collected from the internet itself. So some of the research that are being done over the some of these formulations, the use of Vasanta Kusmakara Rasa in PCOD or PCOS, effect of Vasanta Malti Rasa in Prameha, Brihatvata Chintamani in treatment of Ardita, Pakshagata. These are some of the questions that can be asked in your question papers. Okay, so I have completed some of the formulations also, and I have described about the preparation methods. Thank you for your cooperation and listening patiently. So, and I thank the Panchajanya team for giving me an opportunity. So,
Yes, sir.
all the
It was much
formulations.
important and easy and understandable.
One of the syllabus that is as we go
For the second year
very.
students throughout the state and university.
So the syllabus that is very cautiously prepared for you people is, I think, very useful in your further practices. So be thorough with the formulations that can be prepared at your clinic itself in a small setup. So I hello hello. So I say all the best, all the very best for your exams. So thank you for your cooperation as well as an opportunity. Thank you, one and all.
ಹಲೋ
ಹಲೋ, ಕೇಳಿಸ್ತಾ ಇದೆಯಾ?
ಸರ್ ಸಮ್ ಸ್ಟೂಡೆಂಟ್ ಎಸ್ ಸರ್, ಇಲ್ಲಿ
ಹಲೋ.
ಡೌಟ್ ಕೇಳಿದ್ದಾರೆ ಒಬ್ಬ ಸ್ಟೂಡೆಂಟ್ ಡಿಸ್ಪ್ಲೇ.
ಹಾ,
ಹಾ
ಹೇಳಿ.
ಕೇಳಿಸ್ತಿದೆ ಸರ್. ಕೆಲವು
ಡೌಟ್
ಡೌಟ್
ಇದೆ.
ಸ್ಫೂರ್ತಿ ಅಂತ ಡೌಟ್ ಕೇಳಿದ್ದಾರೆ.
ಸೊ ಓಕೆ. ಓಕೆ, ಫೈನ್. So coming to the question, so by Miss Purti here. So according to the syllabus, newer syllabus, they may ask the question such as explain the preparation method of Samshamani Vati. So please don't get confused with such questions. Samshamani Vati is the name for Guduchi Gana itself. So you are supposed to mention the method of preparing the Samshamani Vati, that is how the Guduchi Gana is prepared. Okay. Guduchi Ghana is prepared. That is, you are supposed to take all the things you can mention. That is the preparation method of Guduchi Ghana, and it can be rolled and it can be used for therapeutic use. So this can be the question and the therapeutic utility. So you can mention during the COVID-19, the Samshamani Vati was being mentioned by central government itself. So these points should be covered in the question. So you can get also some of the questions that are the, so as Chawanaprash is been asked in nutraceuticals also, the write a short notes on utility of Chavanaprasha, as well as it can be for 10 marks also. You are supposed to write about the ingredients as well as the method of preparing, pharmacodynamics as well as pharmacokinetics of Chavanaprasha. So preparation method of Ballataka Taila. So as it is one of the, as Ballataka is having some of the toxic oils there, so that should be prepared very cautiously. So the methods or the steps that can be taken during the preparation, that should be mentioned. So Gandhaka Dhriti, such questions can be asked. So the matra, or they can question about the churna that is used in dhatri, gandhaka taila, or gandhaka dhriti, that is the matra of churna. It may be the question itself. Name the churnas that are used in gandhaka dhriti preparation, as well as the matra of the churna. That can be an MCQ. Okay. Use of Varnakara Lepa, it can be an MCQ itself. Lagusuta Shekara, contents may be the MCQ there. So Trifala Rasayana, so all the, so they may ask it independently also. You should be thorough with the all the formulations of Gandhaka Trifala Rasayana that are being explained in your syllabus. So Charaka Chikitsa Rasayana Adhyaya, it is mentioned. So they may asked independently. Okay. So the matra of Guduchi Swarasa, as well as they can ask the matra of Guduchi Swarasa as an MCQ. Guduchi Hima, and explain the therapeutic utility of Trifalagrata, as it can be used internally as well as it can be used for therapeutic purpose in Akshivikaras. So such questions, dual questions can be asked for you people. So as many of the formulations are very wider approach to question formulations are being mentioned in your syllabus, so be thorough with such peculiar answers, questions there, and be thorough with the ingredients, and make an model that what should be the skeleton of writing these such formulations. Okay. So that should be mentioned. So when you revise the formulations, so many of the formulations are having the peculiarity that should be note down. So in preparation of the ballataka, they have mentioned some of the pieces should be used, cut into small pieces, and it should be used for the further therapeutic use. Such peculiar type of methods should be mentioned in the preparation itself, and the therapeutic utility are very much highlighted in the syllabus itself, so that that can be helpful in your forthcoming practices. So be thorough with all these such questions. Please feel free any of the questions, so that I can answer now. Hello.
Yes, sir. No such questions. Hello.
Hello. Okay. Fine.
Ah, sir.
So please let me, if any of the doubts relating to these two topics, you can message me on WhatsApp. I can give the WhatsApp of my personal WhatsApp, and please note down the number: 87 623 79705. This is the WhatsApp number. If you have any doubts relating to these two topics, you can text me, and so that I can answer your doubts itself. So thank you for your opportunity as well as patient hearing. Thank you.
Thank you, sir, for your wonderful lecture, for accepting our request and conducting the lecture in your busy schedule. We wholeheartedly thank you, sir. With this, we sign off this lecture. Thank you.
Okay, thank you.